Hannibal LaGrange University High School Nursing Competition. This is the Quiz Bowl portion of your day. My name is Catherine Martin, and I will be your host. Our Quiz Bowl is set up Jeopardy style. Who in here has ever watched Jeopardy? Yes! Yes! Please listen closely to the rules of our game. You will soon, behind you, but you'll be sitting up here, see a board with 6 categories and 5 clues in each category, each worth a different amount of dollars, and each dollar is equivalent or equal to 1 point. The higher the value, the more difficult the question will be. Clues will be read by me, your host, and regardless of who picked the clue, any team can buzz in to answer. You will use the iPad on your table to buzz in, and the first team to buzz in gets a go at the question. There's no deduction of points for incorrect answers. There will be approximately 10 seconds per clue before we move on. And as with Jeopardy, your response needs to be phrased in the form of a question. Here's an example. Here's a clue. A wonderful liberal arts university located in America's hometown. Exactly! Perfect. And the team who gets the question correct picks the next clue. You can pick any clue on the board, however, sticking to one category and going from lowest to highest is preferred. Each round of trivia will be limited to 15 minutes. Before we start our first round, Brennan will help the first teams find their places on the stage. You'll be entering the stage to my right, your left, and leaving from the other direction. Brennan, you may call the first teams.
The first teams will be team number 1 from Hannibal and team number 4 from Hannibal. You come up here by the entrance.
Check.
Okay, you have buzzers in front of you. If they go dark, you will need to hit the home button to bring it back up. At any point, if they say disconnected, please let me know. I have to reset them from my phone. I will do that. Any questions? Any requests for me to repeat the rules? Okay, my buzzers are labeled Table 2 right there, and my Table 2 buzzer is Hannibal number 1. Is that correct? Perfect. And my Table 3 buzzer is number 4 Hannibal. Is that correct? Wonderful. Here we go. We are all doing this together, and it's going to be a great day. Let's play some Jeopardy! Okay. Are you ready? We're ready. I will begin by choosing the first. Oh, bring up the board, Mr. Randy. Thank you. We'll now see all of our different categories. The board's there. So we have our categories of problems and illness, ethical and legal, communication, the human body, the whole person, hazards, risk, and safety. And I'm going to start with problems and illness for 200. Passage of liquid, unformed feces. Table, Hannibal number 1 buzzed in. What's your answer?
What is urinary tract?
That is incorrect. Do we have another answer?
What is diarrhea?
That is correct! Okay, so we have 200 points for number 4, Hannibal. Okay.
Warm-up round.
Since you answered that correct, you may pick the next clue on the board. Oh, and I have to reset my buzzers.
Communication?
For how many?
200.
Communication for 200. The process of communicating non-verbally through movements and gestures. So that was number 1, Hannibal.
What is body language?
And that is correct! Number 1, Hannibal for 200 points. Okay, number 1, Hannibal, you may pick the next clue.
Can we do hazards, risk, and safety for 200?
Yes, you may. A cleansing procedure performed by or for patients for hygienic or therapeutic purposes. Number 1, Hannibal.
Shower.
That is incorrect. Number 4, Hannibal, do you have an answer? That is correct. What? Oh, can you phrase that as a question for me?
What is a bath?
That is correct. Thank you. Thank you. Good job. Okay. Perfect. Okay. Number 4, Hannibal. Will you please pick the next clue?
Okay, the human body for 200.
Okay. The structures of the pulmonary system which carry oxygen-rich air to the lungs. Time is up. May I please see the answer? What is an airway? And I'm taking a pause. I needed a pause for a second, I think. Everything has been worth 200 so far. I'm sorry I failed to... 4. Okay, thank you. Okay, so I think we're going to bounce back to Hannibal number 4. Would you pick the next clue?
The whole person for 200.
The whole person for 200. To cause or allow to flow over the edge of its container. Example, a liquid, especially accidentally. Oh no, I did not reset the buzzers. Maybe I did. Okay. And Hannibal, number 1.
What is spill?
That is correct. Very good. So that would be Hannibal number 1 for 200. Number 1, Hannibal, would you pick the next clue, please?
Can we do ethical and logical for 400?
Ethical and legal for 400, please. Making a false spoken statement damaging to a person's reputation. Number 1, Hannibal.
What is false accusation?
That is incorrect. Number 4, Hannibal, do you have an answer? Time is up. Please reveal the answer. What is slander? Number 1, Hannibal, would you pick another clue for us, please?
Can we do ethical and legal for 200?
Ethical and legal for 200. Treatment in a polite and friendly way. Number 4, Hannibal, what is your answer?
What is respect?
I'm going to look to my judge. And that is the correct answer. Thank you, Hannibal number 4. Hannibal number 4 for 200. Okay, Hannibal number 4, please pick the next clue.
Problems and illness for 400.
Problems and illness for 400. Intermittent or persistent pain for a long time. Hannibal number 1.
What is chronic pain?
That is correct. Number 1, Hannibal for 400. Number 1, Hannibal, please pick your next clue.
Can we do problems and illness for 600?
Problems and illness for 600. An inability to digest milk and some dairy products. Number 1, Hannibal, just barely beat that in. And the answer?
What is lactose intolerant?
Correct. Number 1, Hannibal for 600. Number 1, Hannibal. Next clue, please.
Can we do problems and illness for 800?
Problems and illness for 800. Inflammation, sore, or ulcer in the skin over bony prominence. Number 1, Hannibal, what's your answer?
What is pressure ulcer?
Correct. Number 1, Hannibal for 800.
Can we do problems and illnesses for 1,000?
Yes, you may. An abnormal condition that reflects impaired cardiac pumping. Okay, you have the buzz, right? You didn't buzz.
Yeah.
You buzzed. Okay, I thought so. Number 1, Hannibal, what's your answer?
What is chronic heart failure? Or is it arrhythmia?
I am going to look to my judge. Is that correct or incorrect? Not correct. Number 4, Hannibal, do you have an answer? We're out of time on that, and the answer is, what is congestive heart failure? How much time do we have left in this round? 1 more minute, so a few more questions. Number 1, Hannibal, please pick your next clue.
Can we do hazards, risk, and safety for 1,000?
Woo, here we go. Denial, anger, bargaining, depression, and acceptance. Number 1, Hannibal, what's your answer?
What is the stages of grief?
That is correct. Number 1, Hannibal, for 1,000, please pick your next clue.
Can we do the whole person 1,000?
The whole person for 1,000. The minimum infection prevention practices that apply to all patients. Number 1, Hannibal.
What is safety precautions?
Not correct. Do you have an answer, number 4, Hannibal?
No, that would be right.
Washing hands?
That is incorrect. The answer is, what are standard precautions? And that is time up for this round. Thank you so much, number 1 and number 4, Hannibal. You may leave the stage to my left, and Brendan will call the next teams.
The next team up is team number 3 from Hannibal and team number 11 from Hannibal.
Randy, will you go ahead and bring up the board? I'm going to refresh some of the rules, because I think sometimes when it's not your turn, it's hard to listen. So clues will be read by me, your host, regardless of who picked the clue. Any team can buzz in to answer. Use the iPad in front of you to buzz in. If for some reason it gets disconnected, please let me know as soon as possible, and I can reconnect from my phone. No deduction of points for incorrect answers. You'll have approximately 10 seconds per clue before I move on, if there are no guesses. And if one team gives an incorrect answer, I give approximately 5 seconds to the other team before I move on and give the correct answer. As with Jeopardy, your response does need to be phrased in the form of a question. And the team who gets the correct answer will pick the next clue. You can pick from anywhere on the board, however, sticking to one category and moving from lowest to highest is preferred. We'll limit the round to about 15 minutes. Are you ready? Yes. Okay. To confirm, table 2 is my buzzer over here, and in front of me, I should have number 3, Hannibal. Is that correct? And then table 3 is my buzzer there, and over there I have number 11, Hannibal. Thank you so much. My buzzers are correct. I will get started by picking the first clue. So here we go. Ethical and legal for 200. Lack of respect or courtesy, insult. Okay, I have number 11, Hannibal. What is your answer?
What is rude?
That is incorrect. Number 3, Hannibal, do you have an answer?
What is abuse?
That is incorrect. The answer to this question, or the answer to this clue, is what is disrespect? Okay.
Miss Carol.
I will pick the next clue, communication for 200. Ongoing dynamic series of events that involves the transmission of a message from sender to receiver.
I don't know.
Okay, I have,
What's them?
who buzzed? Table 2, so I have number 3, Hannibal. What's your answer?
What is central nervous system?
That is not correct. Do I have an answer from number 11, Hannibal?
Ongoing dynamic series of events that involve the transmission of messages. What? What is transmission relay? Is that what you said?
That's incorrect. The answer is, what is communication?
Carol.
Okay, my table 2, I think you might be disconnected.
Oh yeah, definitely.
Okay.
We have to get something right. We can't do this. We need a little mic in our ear. We suck at this shit.
I know you are because you literally
There you go. We're back in.
Okay.
Here we go. The human body for 200. The process of taking air into and expelling it from the lungs. Number 11, Hannibal, what's your answer?
What is breathing?
That is correct. Number 11, Hannibal, for 200 points. Number 11, Hannibal, please pick our next clue.
Can we do the whole person for 200?
The whole person for 200. An event which causes a person to unintentionally rest on the ground or lower level.
No. Oh my gosh.
Number 3, Hannibal, what is your answer?
What is fainting?
Incorrect. Do I have an answer from number 11, Hannibal?
What is fall?
That is correct. Number 11, Hannibal, for 200 points. And which clue would you like to pick next?
Hazards and risk and safety for 200.
Hazards, risk, and safety for 200. Process of cleaning something, especially with a chemical, to destroy bacteria. Oh,
Yeah,
ooh.
we can't buzz either.
Ooh, well, who's faster? Number 3, Hannibal.
What is disinfecting?
That is correct. Number 3, Hannibal, for 200. And I will reset buzzers right now, and I will not do that again. Here we go. Good job. Number 3, Hannibal, please pick our next clue.
Problem and illnesses 200.
Problems and illness for 200. Accumulation of hardened fecal material in the rectum. Number 3, Hannibal.
What is constipation?
That is correct. Number 3, Hannibal, for 200. Number 3, Hannibal, please pick our next clue.
Problems and illness 400.
Problems and illness for 400. Abnormal accumulation of fluid in interstitial spaces of tissues.
Oh, it might be like cyst.
Number 11, Hannibal.
What is cyst?
That is incorrect. Number 3, Hannibal, do you have an answer?
What is anemia?
That is incorrect. You are so close. What is edema? I think you were almost there. And who had our last question correct? I don't remember.
They did.
You did, okay. Number 3, Hannibal, will you please pick our next clue?
Okay. Well, I should do the human body next. Actually, I don't know.
Problems and illness for 600. A disorder characterized by abnormal loss of bone density. Number 3, Hannibal.
What is osteoporosis?
Correct. Number 3, Hannibal, for 600. Excellent job.
We're getting cooked. We're getting cooked.
Okay, number 3, Hannibal. Next clue, please. Problems and illnesses for 800. A hyperexcitation of neurons in the brain leading to sudden, violent, involuntary contractions of the muscles. Number 11, Hannibal, what is your answer?
What is seizures?
That is correct. Number 11, Hannibal, for 800. Please pick our next clue.
Can we do human body 400?
For how many?
400.
Human body for 400. The action or process of vomiting. Number 11, Hannibal.
What is regurging?
Incorrect. Number 3, Hannibal, do you have an answer?
What is regurgitate?
Incorrect. The answer is, what is emesis?
I wouldn't know. I would not have known that. I would have not known
Number 11, Hannibal, please pick our next clue.
the human body. Can we do the human body for 600?
Human body for 600. The way a person moves as they go about their daily life, when sitting, standing, lifting, carrying, and bending. Number 3, Hannibal.
What is activities of daily living?
That is correct. Number 3, Hannibal for 600. Number 3, Hannibal, please select our next clue.
Problems and
Problems and illnesses for 1,000. A group of diseases resulting in too much sugar in the blood. High blood glucose. Number 11, Hannibal.
What is diabetes?
Correct. Excellent answer. One more minute. Number 11, Hannibal, please select our next clue. That was number 11 for 1,000. Okay, next clue.
Can we do hazards, risks, and safety for 600?
Hazards, risk, and safety for 600. The use of pets to improve physical and mental health of patients.
Oh my God.
Number 3, Hannibal.
What is service animals?
That is incorrect. Number 11, Hannibal.
What is therapy? I guess mental therapy.
Can you elaborate?
Mental therapy or like some type of, what is it called? Psychological therapy?
I'll take that answer. So number 11 for 600. What is pet therapy?
Pet therapy.
Perfect. Thank you to my judge. Last question. Number 11, Hannibal, please pick our final clue for this round.
Can we do whole person for 1,000?
The whole person for 1,000. Go big or go home. Changing a patient's position in bed every 2 hours. I'm sorry. Okay. Number 3, Hannibal.
What is rotation?
Not correct. Number 11, Hannibal. Do you have an answer?
We should know this. Change a person's position every 2 hours. What is rotation? I don't think I know.
Incorrect. The answer is, what is repositioning?
All right, the time is up.
Excellent
I'm sorry,
job,
Carol.
number 3 and number 11, Hannibal. You
Good.
may now leave the stage to our left.
Carol, I am very sorry.
We will now have number 2 from
Great job,
Hannibal,
great job.
number 5 from Hannibal, and number 13 from DHCC.
We believe that accessing care close to home is better for you and better for your family. For 120 years, Hannibal Regional has been committed to providing community-based, contemporary health care, from state-of-the-art surgical care to innovative cancer care, and now life-saving open-heart surgery. We are dedicated to expanding access to exceptional care in each of the communities we serve. Hannibal Regional, why go anywhere else?
Bring up the board for us while I confirm my teams. So, table 1 buzzer over there, I should have number 2 Hannibal, correct. My table 2 buzzer, I have number 5 Hannibal, correct. And then my table 3 buzzer, I have number 13, DHCC, David Hart Career Center. Did I get it right? Yes. Here we go. I'm going to go home and sleep tonight. That's what I'm going to do. Okay, if your buzzers come disconnected, let me know as soon as possible. If I don't reset, also let me know as soon as possible. I will try my best to do that. You have heard the instructions twice now. I think we're ready to go, and we're ready to have fun and answer as many questions as we can. So I'm going to get started by picking the first clue. Anyone can buzz in. They are set. Do y'all feel ready? Let's go. So to get started, we're going to do problems and illness for 200. Condition characterized by difficulty in passing stool or infrequent passage of hard stool. And my first one is number 2, Hannibal. What is your answer?
What is constipation?
And that is correct. Hannibal, number 2 for 200. Very good. Hannibal, number 2, please pick our next clue.
Problems and illness, 800.
Problems and illness for 800. A result when a blood clot blocks blood flow. Disconnected? To the heart, okay. I think we're good now. Reset all buzzers. Are you still disconnected? Okay. A result when a blood clot blocks blood flow to the heart. I think I probably already have a buzz from table 1. Number 2, Hannibal. They did buzz first. Okay. So we're going to do number 3. Number 13, DHCC. What is your answer?
What is cardiovascular blockage?
Not correct. I'm going to go to number 2, Hannibal. What is your answer?
What is heart attack?
That is correct. Number 2, Hannibal for 800 points. Number 2, Hannibal, please pick our next clue.
Problems and illness, 400.
Problems and illness for 400. Condition characterized by chronic inability to sleep or remain asleep through the night. Did I do it wrong again? We did. Okay, I have table 1, so I'm going to do Hannibal number 2. Hannibal number 2, what is your answer?
What is insomnia?
That is correct. Hannibal number 2 for 400 points. All my buzzes are reset right now. And everyone is activated. No one is disconnected. We should go for the next question. They just got their 400 points. You get that? Perfect. Please pick our next clue.
The human body, 400.
The human body for 400. Waste matter discharged from the bowels after food has been digested. Excrement. Number 2, Hannibal, yet again.
What is feces?
Hold on, I have to see my answer. That is correct. Number 2, Hannibal for 400. Okay, please pick our next clue.
The human body, 200.
The human body for 200. Buzzers have all been reset. They are all connected. Movement of blood through the vessels through the body by the pumping action of the heart. Number 13, DHCC was the first one to buzz in. And what is your answer?
What is heartbeat?
That is incorrect. Number 2, Hannibal was second to buzz in.
What is blood flow?
Incorrect. Number 5, Hannibal, do you have an answer?
What is circulation?
That is correct. Number 5, Hannibal with 200 points. Number 5, Hannibal, please pick our next clue.
We'll do hazards, risk, and safety 200.
Hazards, risk, and safety for 200. Practices conducive to maintaining health and preventing disease. Cleanliness. Number 2, Hannibal was the first to buzz in. What is your answer?
What is standard precautions?
That is incorrect. Number 13, DHCC, what is your answer?
What is What is hygiene?
That is correct. Number 13, DHCC for 200 points. Please pick our next clue.
Human body 1,000.
Human body for 1,000. The brain and spinal cord. Number 2, Hannibal was the first to buzz in. What is your answer?
What is the central nervous system?
Correct. Number 2, Hannibal for 1,000. Number 2, Hannibal, please select our next clue.
Communication 200, please.
Communication 200. Transfer of information from one person to another without words or spoken language. Number 2, Hannibal was the first to buzz in.
What is nonverbal communication?
Correct. Number 2, Hannibal for 200. Next clue.
The whole person 200, please.
The whole person for 200. An undesirable event that occurs unintentionally and usually results in harm, injury, damage, or loss. Number 13, DHCC, what is your answer?
What is an accident?
That is correct. Number 13, DHCC for 200. Please pick our next clue.
The human body 800.
The human body for 800. To make or become wider, larger, or more open. Number 2, Hannibal.
What is to expand?
That is incorrect. Number 5, Hannibal.
What is dilation?
Correct. Very good. Number 5, Hannibal for 800.
Oh.
Number 5, please
Sorry.
select our next clue. I was also taking a break. It wasn't you. I was breathing.
We'll do the whole person 400.
The whole person for 400. Personal protective equipment, PPE, that provide a barrier to germs and your hands. Number 2, Hannibal.
What is gloves?
Correct. Number 2, Hannibal for 400.
Ethical and legal 200, please.
Ethical and legal for 200. Perfect. Failure to provide proper care. Number 2, Hannibal, what is your answer?
What is negligence?
That is correct. Number 2, Hannibal for 200. We have about 5 more minutes for this round.
Problems and illness 600, please.
Problems and illness for 600. I had reset my buzzers. Here we go. Abnormal progressive condition of the lens of the eye, characterized by the loss of transparency. Number 2, Hannibal, what is your answer?
What is cataracts?
That's correct. Number 2, Hannibal for 600. Please select our next clue.
Ethical and legal 400.
Ethical and legal for 400. Having a hostile or deliberately frightening quality or manner. Number 2, Hannibal.
What is aggression?
That is correct. My judge says yes. Okay. Next clue, please.
The human body, 600.
The human body for 600. Everyone close your eyes. Are we good? That's not the human body one. We were on the human body for 600. Okay, movement of a joint from maximum extension to maximum flexion as measured in degrees.
What is range of motion?
Okay, table 2. Sorry, we were all sorts of buzzed off by that. That is correct. Hannibal 2 for 600. How many more minutes do we have for this round? 3 minutes, okay. Actually, I'm the host. I'm going to play the audible, and I am going to call the clues from here on out because my board has not been reset. And so I am going to call the clues only, and I'm going to go pick one and go straight down. And you guys will get to keep guessing, and you get to follow my lead from here on out because my board has not been reset. We won't duplicate any questions. How's that sound? Sound good? Perfect. We're going to follow my lead from there on out. I'm going to reset my buzzers, and we're going to go from there. I've been disconnected. Let me reconnect as my host. Okay, everyone's in. Reset all the buzzards. Here we go. So we're going to do communication for 400. Unkind, disapproving, or untrue conversation about a person's private life. Okay, so I have Hannibal number 2. What is your answer?
What is rumors?
Not correct. Number 13, DHCC, what is your answer?
What is gossip?
That is correct. Number 13, DHCC for 400. Perfect. And the next clue that I'm going to do is going to be communication for 600. Any degree of hearing loss from mild to profound. Hannibal, number 2, Hannibal, what is your answer?
What is deafness?
Incorrect. Hannibal number 5, what is your answer?
I was going to say that. What is hearing loss?
Incorrect. And number 13, DHCC, do you have an answer?
What is chronic hearing loss?
Incorrect. The answer is what is hearing impaired? Ah, there we go. One more minute. We will do one last question. And I have been kicked out yet one more time as the host. Okay. Communication for 800. The act of a patient denying cooperation with the healthcare provider's request or assistance. Number 2, Hannibal, what is your answer?
Denial of care. What is denial of care?
Incorrect. Number 5, Hannibal, what is your answer?
What is resistance?
Incorrect. Number 13, DHCC, do you have an answer?
What is patient's rights?
Incorrect. So you got closer. What is patient refusal? There we go. And that is it for the first round of Jeopardy! Good job, everybody!
Good job.
The next teams to compete will be team number 1 from Hannibal and team number 11 from Hannibal.
Once the board fully loads, I will again get us started by choosing the first clue.
So I saw y'all root
We'll go from there.
for us. Let's be real. Okay. We are underdogs.
Let's begin with problems and illness for 200. Difficulty in swallowing. Number 11, Hannibal, what is your answer?
What is
Hold
dysphagia?
up. I don't think you're number 11, Hannibal. And I do think that you buzzed in first. So number 11, Hannibal, what is your answer?
Difficulty choking? What is choking? No. Okay.
Not correct. Bounce back over here. Number 1, Hannibal, what is your answer now?
What is dysphagia?
That is correct. Good job. Number 1, Hannibal, for 200. Okay. Buzzers are reset. We are ready to go. Number 1, Hannibal, please select our clue.
We would like to do problems and illnesses for 400, please.
Problems and illnesses for 400? Okay. Progressive loss of intellectual functioning, impairing of memory. Number 11, Hannibal, what is your answer?
What is dementia?
That is correct. Number 11, Hannibal, for 400. Next clue.
Can we do communication for 200?
Communication for 200. Information that can be observed by others, free of feelings, perceptions, and prejudices. Number 1, Hannibal, what is your answer?
Is it Residents' Bill of Rights?
That is not correct. Do I have an answer from number 11, Hannibal?
What is body language? It's not body language.
That is not correct.
It's going to be
The answer is, what is objective data?
Oh, nope, didn't know that.
Number 11, Hannibal, please select our next clue.
The human body for 400.
The human body for 400. Fluids from the glands that line the nose, mouth, throat, and windpipe.
No, it's not.
Number 1, Hannibal.
What is lymph nodes?
Incorrect. Number 11, Hannibal, do you have an answer?
What is mucus?
That is correct. We will accept that answer. What are secretions? So that would be number 11, Hannibal, for 400. Okay, thank you. Next clue.
The human body for 600.
Human body for 600. Gas in the intestinal tract or gas passed through the anus. Number 11, Hannibal.
I know the technical term for this, but what is a fart?
Not an acceptable answer today. And number 1, Hannibal, what is your answer?
What is flatus?
That is correct. Number 1, Hannibal, for 600. What is flatus? Number 1, Hannibal, please select our next clue.
Can we do problems and illnesses for 1,000?
Problems and illnesses for 1,000. A disease of the nervous system marked by tremor, muscular rigidity, and imprecise movement. Number 1, Hannibal.
What is rigor mortis?
That is not correct.
It's a disease, though. What is a stroke?
What did you say?
What is a stroke?
Not correct. The answer is, what is Parkinson's disease? Okay.
We should have known that one.
Who had the last one correct?
They did.
Was it you? Okay, pick our next clue for us, please.
We're going to do problems and illnesses for 800.
Problems and illnesses for 800. Gradual destruction of the alveoli, tiny air sacs. Time is up. Please reveal the answer. What is emphysema? Number 1, Hannibal, please select our next clue.
We're going to do problems and illnesses for 600.
Problems and illness for 600. Yellow discoloration of the skin, mucous membranes, and sclera. Number 1, Hannibal, what is your answer?
What is jaundice?
That is correct. Number 1, Hannibal, for 600. Number 1, Hannibal. Next clue.
Can we do the whole person for 400?
The whole person for 400. Procedures used to reduce the number of microorganisms and prevent their spread. Number 11, Hannibal.
What is safety precautions?
Wait, hold up. Number 11, Hannibal, buzzed in first.
What? It's not
Right?
What is safety precautions?
Not correct. Number 1, Hannibal.
What is contact precautions?
Incorrect. The answer is what is medical asepsis?
What even is?
I believe number 1, Hannibal, will you select my next clue for me?
We're going to do the whole person, 600.
The whole person for 600. Personal protective equipment. Number 1, Hannibal, what is your answer?
What is PPE?
Correct. Number 1, Hannibal for 600. If you listened earlier, you heard that one. Okay, number 1, Hannibal, next clue.
Can we do the human body for 800?
The human body for 800. Flexion toward the back. Number 1, Hannibal.
What is abduction?
What is what?
Abduction?
That is incorrect. Number 11, Hannibal, do you have an answer?
Flexion towards the back. What? It's abduction. Flexion towards the back. I don't know. Flexion towards the back. What'd you say?
That is time. And the correct answer is what is doriflexion? Number 1, Hannibal, will you please select our next clue?
We're going to do hazards, risk, and safety for 200.
Hazards, risk, and safety for 200. An approach to wellness that addresses the physical, mental, emotional, social, and spiritual components of health. Number 1, Hannibal.
Can we pass?
Okay. Number 11, Hannibal. They failed to come up with an answer. Do you have an answer?
I don't think it's more swag. Oh my God. What is emotional well-being? I don't know.
Okay. The answer to this is what is holistic care? Okay. Number 1, Hannibal, would you please select our next clue?
Yeah. Is it ours?
Yes.
Can we do ethical and legal for 400?
Ethical and legal for 400. A person's desires regarding medical treatment when they are no longer able to express informed consent. Number 1, Hannibal, you buzzed in first.
What is power of attorney?
Incorrect. Number 11, Hannibal, do you have an answer?
What is incompetence?
Incorrect. What is a living will?
A living will.
Number 1, Hannibal, will you pick our next clue, please?
Can we do the human body for 200?
The human body for 200. A large tube-like structure extending from the larynx to the bronchial tubes, windpipe. Number 11, Hannibal, you buzzed in first.
What is the esophagus?
Incorrect. Number 1, Hannibal, do you have an answer?
What is trachea?
That is correct. Number 1, Hannibal, for 200 points. We have 4 minutes left in this round, so just a few more questions. Number 1, Hannibal, what's our next clue?
We're gonna do the human body for 1,000.
Okay. The human body for 1,000. Without fever, number 1, Hannibal. You buzzed in first.
Sorry. It's non-febrile, or like afebrile.
That is correct. Number 1, Hannibal for 1,000 points. Good job. Please select our next clue.
Hey, you know, we won one round. Do that.
Hazards, risks, and safety for 400, please.
Hazards, risk, and safety for 400. The state of being comfortable, healthy, or happy. Number 1, Hannibal.
What is content?
Incorrect. Number 11, Hannibal. Do you have an answer?
What is
Time is up. The answer is, what is well-being?
Didn't say it next time. Be like, say it.
Number 1, Hannibal. Please select our next clue.
It's cool. Like, you should just like kind of.
We're gonna do the whole person for 200.
The whole person for 200. An organism causing disease to its host.
Oh my gosh.
Number 1, Hannibal.
What is parasite?
Incorrect. Number 11, Hannibal.
They just said parasite. What is microorganism?
Incorrect. What is a pathogen?
We're out. We're out.
Number 1, Hannibal. Next clue, please.
Can we do hazards, risk, and safety for 600?
Hazards, risk, and safety for 600. A subjective set of guiding principles and beliefs held that influence your decisions, actions, and choices in life. Number 11, Hannibal.
What is religion?
Incorrect. Number 11, Hannibal. Number 1, Hannibal.
What is care plan?
Incorrect. What are personal beliefs? We have time. one more question. Last question. Number 1, Hannibal, please select our last question.
The whole person, 1,000.
The whole person for 1,000. Diseases spread through coughing, sneezing, laughing, and close personal contact. Number 1, Hannibal.
What is droplet precaution? Or droplet
It's contact.
airborne precaution?
It's not. It's contact.
Can you expand on that a little bit?
like
COVID. Airborne precautions, like you have to wear your mask. Right? COVID.
Incorrect.
like it's transferred through the air?
Number 11, do you have an answer?
What is close personal contact precautions? Okay. Boom.
Incorrect. What are airborne transmitted diseases?
This is
Okay, thank you so much. You may now exit the stage to the left.
Teams that are next are number 2 from Hannibal and number 5 from Hannibal.
Providing community-based contemporary healthcare, from state-of-the-art surgical care to innovative cancer care, and now life-saving open-heart surgery. We are dedicated to expanding access to exceptional care in each of the communities we serve. Hannibal Regional, why go anywhere else?
2 here and 5 there. Okay.
Oh my God, that's heavy.
Go ahead and load it up.
Bring it on up. Let's not have tech glitches this time, okay?
Yes. No promises.
We have to communicate.
Oh.
Oh. Number 2? You're number 2? Team, you're number 5. Here we go. Okay, we're ready. Let's do this. We all know the rules. We're ready to go. I have number 2 Hannibal. I have number 5 Hannibal. I'm still Catherine. We're not going to have any tech issues this time. Here we go. Let's get started with the problems and illnesses. It's my favorite for 200. Shortness of breath. Oh, nope, I already messed up. Number 2 Hannibal. What's your answer?
What is bradyapnea?
Not correct. Number 5 Hannibal. Do you have an answer?
I don't know. We don't have one.
Okay, the answer is, what is dyspnea? I will pick the next clue. Problems and illness for 400. Unjustified suspicion and mistrust of other people or their actions. Number 2 Hannibal, what is your answer?
What is distressed?
Not correct. Number 5 Hannibal.
What's paranoid?
Correct. Number 5 Hannibal for 400. Please select our next clue.
We'll do the human body 200.
The human body for 200. Chemical substances that function as messenger molecules in the body. Number 5 Hannibal.
What is hormones?
That is correct. Number 5 Hannibal for 200. Next clue, please.
Problems and illnesses 600.
Decreased blood supply to a body part. Number 2 Hannibal.
What is blood loss?
Incorrect. Number 5 Hannibal, do you have an answer?
What is lack of circulation?
Incorrect. The correct answer is, what is ischemia? Okay. Number 5 Hannibal, I believe I need you to select my next clue.
The whole person 200.
An organism that can only be seen through a microscope. Examples are bacteria, protozoa, and fungi. Number 2 Hannibal, you buzzed in first.
What is microscopic organism?
That I will accept. What is a microorganism? Number 2 Hannibal for 200. Please select my next clue.
Ethical and legal 1,000.
Ethical and legal for 8,000. Health Insurance Portability and Accountability Act acronym. Number 2, Hannibal. What is your answer?
What is HIPAA?
Correct. Number 2, Hannibal for 1,000. Next clue, number 2, Hannibal.
Ethical and legal 600.
Ethical and legal 600. Enforceable protections and guarantees of individuals receiving medical care. Number 2, Hannibal.
What is patients' rights?
That is correct. You're good. That's number 2, Hannibal for 600. Thank you. Next clue, please.
Ethical and legal 400.
Ethical and legal 400. A health record providing systematic documentation. It won't buzz. It won't buzz, or you already buzzed? Okay, you buzzed? You've buzzed. Okay, perfect. Can I finish reading, but you buzzed? Perfect. A health record providing systematic documentation of a single patient's history and care across time. Number 2, Hannibal, what's your answer?
What is a medical file?
You won't take that? You won't, okay, come here. That is incorrect. You have a chance. Do you have an answer?
What is medical record?
That is correct. Number 5, Hannibal for 400. Thank you for my judge. He is an expert. I am not. Okay. Number 5, Hannibal, please select the next clue.
The human body 400.
Okay, you should be able to buzz. Human body for 400. The pressure of blood pressing against the walls of your arteries. Number 2, Hannibal.
What is pulse?
Incorrect. Number 5, Hannibal.
What is blood pressure?
That is correct. Number 5, Hannibal for 400. Number 5, Hannibal, please select our next clue.
Problems and
Please don't bring up the clue. I've been disconnected from the room and I need to do a tech refresh. Thank you. Okay, I think it's fine. I think you guys can all buzz. You can buzz. Yeah. What clue did you say?
problems and illnesses 800.
Problems and illnesses for 800. Thank you. A disorder in which nerve cell activity in the brain is disturbed, causing seizures. Number 2, Hannibal.
Can we pass, please?
Yes, you may pass. Do you have an answer? Number 5, Hannibal.
What is epilepsy?
That is correct. Number 5, Hannibal, for 800. Number 5, Hannibal, please select our next clue.
Hazards, risk, and safety for 200.
Hazards, risk, and safety for 200. Food, water, air, and shelter. Number 2, Hannibal.
What is basic needs?
That is correct. 5 more minutes for this round. Number 2, Hannibal, for 200. And also please select our next clue.
Hazards, risks, and safety, 1,000.
Hazards, risk, and safety for 1,000. Specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness. Number 2, Hannibal, your answer is
What is hospice?
not correct. Number 5, Hannibal, do you have an answer?
No.
And the answer is, what is palliative care? Okay, I believe it's number 2, Hannibal, that needs to pick my next clue for me.
The whole person, 1,000, please.
The whole person, 1,000. Microorganisms such as bacteria or viruses that are carried in blood that cause disease in people. Number 2, Hannibal. What is your answer?
What is a bloodborne pathogen?
That is correct. Number 2, Hannibal, for 1,000.
The whole person, 800.
What did you, for what?
The whole person, 800, please.
Whole person for 800. Did it do it? Yeah, we got it. Oh, okay. You can't click before I even bring up the clue, guys. Contagious or infectious? Number 2, Hannibal. What's your answer?
What is transmittable?
In that, we will accept the answer. What is communicable? So that is number 2, Hannibal, for 800. Number 2, Hannibal, please select our next clue. Don't push the buzzer until the clue shows up on the screen. What clue would you like to pick?
Problems and illness, 1,000.
Problems and illness for 1,000. An inherited condition in which nerve cells in the brain break down over time. Number 2, Hannibal.
What is Huntington's disease?
That is correct. Number 2, Hannibal, for 1,000. Next clue, please. 2 minutes.
The whole person, 600.
The whole person, 600. Remove, alarm, confine, and extinguish or evacuate acronym. Number 2, Hannibal.
What is race?
Correct. Number 2, Hannibal, for 600. We're going to do one more question. Number 2, Hannibal, please select our last clue.
The whole person, 400.
The whole person for 400. A practical, evidence-based approach preventing patients and health workers from being harmed by avoidable infections. Number 2, Hannibal.
What is infection control?
That is correct. Number 2, Hannibal, for 400. Thank you so much. You may exit the stage to my left.
right, so for our final round of this bracket, it will be Hannibal number 1 and Hannibal number 2 competing.
And then we're going to take that. It's just easier for
You'll have to communicate with me. It's okay. You have to communicate.
3A?
Yes.
Jenna, no pushing the buzzer until you got the answer.
Yeah.
That's Jalen, not me.
Jalen, slow down.
Wait for it to pop up and move the buzz, okay? Look at us like this.
Number 1, Hannibal?
Yeah.
Number 2, Hannibal?
Yes.
Y'all, that makes sense. Here we go, left and right. Yeah, you can go get a cough drop.
We got this. Remember, this is for Hannibal. Huh? Jenna, hashtag Team Oreo. Hashtag whale.
Okay, let's go. Board's coming up. Same categories we're used to. Problems and illness, ethical and legal, communication, the human body, the whole person, hazards, risk, and safety. If I don't know for sure if your answer is correct, I will still look to my judge back here, and as you have probably noticed, the answers are getting more difficult the deeper we get in these rounds. And they will get more difficult. Again, I will start by selecting the first clue, and we have decided, since we're a little behind, that we are going to limit this round to 10 minutes, both morning and afternoon instead of 15. So it will be fair in the count, so we're going to do a 10-minute round for this final round 3 of Jeopardy. Problems and illness for 200. It's coming. An illness of rapid onset and short duration. Person is expected to recover. Number 2, Hannibal. What is your answer?
Pass, please.
What?
Pass.
Okay, number 1, Hannibal, do you have an answer?
What is short term?
Okay, bring up the answer, please. What is an acute illness? I will select the next clue for us. Ethical and legal for 200. A rule of conduct made by a government body. Number 1, Hannibal.
What is a law?
That is correct. Number 1, Hannibal for 200 points. Please select our next clue.
Can we do problems and illnesses for 400?
Problems and illnesses for 400. 103 Fahrenheit body temperature. Number 2, Hannibal.
What is a fever?
That is correct. Number 2, Hannibal for 400. Please select our next clue.
Ethical and legal 400.
Ethical and legal for 400. Any occurrence that has harmed a patient, resident, visitor, or staff member. Number 1, Hannibal.
What is a grievance?
That is incorrect. Do you have an answer? Number 2, Hannibal?
What is abuse?
Incorrect. The answer is, what is an event? I believe it is number 2, Hannibal. I would like you to select my next clue.
Ethical and legal 600.
Negligence by a healthcare professional. Number 1, Hannibal.
What is abandonment? Abandonment?
That is incorrect. They said abandonment. Number 2, Hannibal. What is your guess?
What is malpractice?
That is correct. Number 2, Hannibal for 600 points. Number 2, Hannibal, will you please select our next clue?
Problems and illness 600.
A loss of appetite. Number 1, Hannibal.
What is anorexia?
That is correct. Number 1, Hannibal for 600.
Don't be doing that.
I miss our crowd. You guys got any clapping in you? Maybe a little? A few? Thank you. Thank you. Excellent work. Okay. Number 1, Hannibal. Next clue, please.
Can we do problems and illnesses for 800?
Problems and illnesses for 800. Any lost, absent, or impaired physical or mental function. Number 2, Hannibal, buzzed in first.
What is loss of ability?
We will accept that answer. What is a disability? But we will accept that answer. So we have Hannibal, number 2, for 800 points. Thank you. Number 2, Hannibal, please select our next clue.
The whole person 600.
The whole person, 600. Making decisions based on evidence and clinical reasoning. Number 2, Hannibal.
What is objective reasoning?
Incorrect. Number 1, Hannibal.
What is clinical judgment?
That is correct. Excellent. Number 1, Hannibal for 600. Please select our next clue.
Can we do problems and illnesses for 1,000?
Yes, you may. Damaged or flawed memory, thinking, reasoning, understanding, or judgment. Number 1, Hannibal.
What is dementia?
Incorrect. Number 2, Hannibal. Do you have an answer?
What is brain damage?
Incorrect. What is impaired cognitive function? Number 1, Hannibal, will you please select another clue?
Can we do the whole person's 1,000?
The whole person, 1,000. Implementing measures to reduce the chances of damage from a situation. Number 2, Hannibal.
What is safety precautions?
We will accept that answer. Excellent work. What is risk reduction? So that was number 2, Hannibal, for 1,000.
The whole person, 400.
The whole person, 400. The fact or condition of being regarded or treated as more important. Number 2, Hannibal.
What is valued?
Incorrect. Number 1, Hannibal, do you have an answer?
What is main priority?
Correct. What is priority? Number 1, Hannibal, 400 points. Good job. Number 1, Hannibal, please select a clue.
Can we do the human body 1,000?
The human body, 1,000. An automatic process. A person's body is steady on the inside and adjusting to changes and conditions on the outside. Number 2, Hannibal.
Did you call?
I think I called you. Number 2, Hannibal. Yes?
What is homeostasis?
Correct. Number 2, Hannibal, for 1,000. Good job. We're going to do one more question. Number 2, Hannibal, please select our final question for this round.
Hazards, risk, and safety, 200.
Hazards, risk, and safety, 200. To engage in physical activity to sustain or improve health. Number 1, Hannibal, what is your answer?
Social therapy?
Incorrect. Number 2, Hannibal, do you have an answer?
What is physical therapy?
We'll accept that answer. What is exercise? What is physical exercise? Good job. Number 1, Hannibal, 200 points. No, that was incorrect. Number 2, Hannibal, 200 points. Did you get that mess up? Thank you. Very good. And that is it for this final round of the Morning Quiz Bowl. Good job, everybody. Good job.